The clinical vignette is you have consulted two multidisciplinary team meeting in the fetal-maternal unit. The mother is primary gravid and has no morbidity. The image of antenatal fetal ultrasound done at 32 weeks is shown below in the coming next slide. The earlier fetal ultrasound done at 18 weeks was reported as baby is well and has no abnormality. So this is the clinical synopsis or the clinical vignette about the short scenario related to multidisciplinary team meeting, which is commonly encountered in pediatric nephrology work. So we are invited for fetal-maternal unit to discuss or to counsel the parents about the outcome of the pregnancy if there is renal anomaly. And this is very commonly happen to found the ultrasound is different in the first half of pregnancy compared to the last half of the pregnancy. And this is usually the mother blaming or the parents, I mean, blaming the initial ultrasonographer, which is not detecting this during the first half of the pregnancy. And this is very obvious mainly for the obstructive uropathy. So before the fetal urine start to develop. When the fetal unit start to develop and increase by the second part of the pregnancy, you will find the high urine output. So if there is any obstruction, you will the dilatation of the renal pelvis and the ureter will become more apparent. So what happened in this scenario? So we have 4 questions here. So the first question is describe the finding in the urinary system in the picture above. What are the most important information you want to know from the parents or from the obstetrician? What is the best image modality you will request after delivery? And finally, how do you counsel the parents? Here is the ultrasound present in with this case. So this fetal ultrasound of the baby at age of 32 weeks. And it's very obvious here, and this arrow pointing to that there is huge cystic mass inside the abdomen of the baby. You can see the head on the left and the leg on the right side, and there is huge cystic structure in the abdomen of the baby. The most common cause of this is enlarged bladder, so the bladder is hugely enlarged. And if you concentrate more on the right side of this structure, you will find also some protrusion at the end, which is denoting the posterior urethra connected to the bladder. And this structure, this pattern with huge I mean enlarged bladder and dilated posterior urethra, proximal urethra, I mean, is called the keyhole pattern, which is diagnostic for posterior urethral valve. Here I can show you the two video about the posterior urethral valve in antenatal ultrasound. So you can see here the kidney, both kidneys, one on the right and one on the left here. And then this is a longitudinal section. The kidney is very clear now. It is in longitudinal scan. And the bladder is not distended, or it may be mildly distended if it's full of urine, but commonly you don't see the bladder. If the bladder is huge and appear, so this means that the bladder is abnormally or the bladder is obstructed. Here is another picture for the kidneys in normal child with normal bladder, the kidney, how it's appear antenatally and during the fetal life, and how it present in posterior urethral valve, as you saw in the picture above. Coming back to questions now, so we can see here. Sorry for that. So this is the video for posterior urethral valve. It shows very clear here the keyhole sign of posterior urethral valve with the enlarged bladder and proximal urethral dilatation. Now you need to come back to the questions. So the questions here is the first question, describe the findings in the urinary system in the picture above. So we can describe like huge distended urinary bladder with keyhole signs denoting this child might have posterior cerebral valve or suggestive of posterior cerebral valve. The second question is what are the most important information you want to know now?